This video is for those who are suffering from alopecia, balding, or thinning hair. Be sure to like or subscribe to the channel and enjoy this video.
Inflammation around the hair follicles. I don't know how detailed we want to get, but sometimes that may include topical steroids. It may include injecting steroids, applying some hair growth stimulants like topical minoxidil compounded with other things to actually help more hair to come in. So it really helps to get the guidance of a dermatologist.
A visit to the dermatologist for hair loss can be covered by many insurance plans. And I know a lot of people don't know that, but the longer you wait, the more likely we are to see scarring, and the less likely we are able to bring back the hair.
So if someone puts a hairstyle in, they realize they have an issue, and a couple months later they seek care, they're really going to be in a way better position than waiting 10 years to come in. Their outcome is going to be better and probably and way faster than someone who has been doing it for 10 years.
We mentioned steroids, where we could start topically or we can even inject them. In my practice, it can range anywhere between $1 to $150 per injection. If you have insurance, that can be covered. Out of pocket, we do have a sliding scale as well. And so that is to be able to help people who don't have insurance, but it's not thousands of dollars.
Okay, yeah, I thought you were going to say like 1,000, 2,000. So yes, that's reassuring.
So how long does it take for people to see results?
2 to 3 injections to start to see results because of the hair growth cycle and how it works. But I tend to see the best results between 3 and 6 months after we, implement a treatment plan. I start out with steroids, but if we don't see the benefit of that, I do talk about a treatment called PRP, that we draw your blood and we remove platelets that have growth factors, etc., in them to help stimulate hair growth. It can be an option depending upon how extensive the edge loss is. I also talk to my patients about the fact that sometimes traction alopecia can unmask an underlying hair loss problem. If the injectables or the steroids don't work, do we need to consider a biopsy? Are we missing something else? Because what can happen is we can lead to a more chronic form of hair loss or even scarring of the follicles where there is no hope of bringing those follicles back. And once they scar, we may have to move on to other options like considering transplant.
It's really at the end of the road. That person has done multiple, types of medical treatment, maybe even some other treatments that may not even be on the main path of treatment. And this is what they have. These follicles have, been treated with multiple things. They're not coming back. So once that patient is deemed stable, yes, a hair transplant is possible. That is something that's cosmetic. Insurance doesn't cover it, but all hair transplant surgeons are not created equal. So you actually would want to go to someone who is familiar with doing hair transplant on people of color, because our hair is different. Our follicle shape is different.
We always put in a plug, whether you use this or not, for blackdermdirectory.com. It's a great resource to find dermatologists that are Black, that are familiar with our hair type. And I think that that's the best way that